Hi, Audrey Christie McLaughlin here with audreychristie.com. Today we're going to talk about dun, 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 inflammation. So much fun, right? So, a little bit about me. I'm a registered nurse, certified clinical master of aromatherapy, Reiki master, all around wellness guru, and I specialize in helping people move into energetic and physical wellness because all dis-ease starts on an energetic level. So today let's talk about inflammation, and we're going to talk about inflammation on the physical level. I'll be back in the next video to talk about energetic inflammation. So first we're going to talk about the symptoms that you probably notice and know, and then we'll come back and talk about the underlying root cause, because sometimes we can't get to that root cause, that energetic issue, without getting some relief in our human suits first. So first of all, inflammation, it gets a really bad rap because it is a normal and beneficial process, but where it goes wrong is when we have chronic inflammation. So let's look at acute inflammation. That's a hard word to say a bunch of times. Inflammation occurs when white blood cells and chemicals or hormones in your body protect you from foreign invaders like bacteria or viruses. So the white blood cells come and they surround that bacteria or virus, and they get big and inflamed. So acute inflammation is like red and swollen, and maybe it has pus. Gross. But that is a beneficial inflammation when it's fighting that bacteria or virus. We need that to survive. It's a normal and beneficial process in our bodies. However, and you do need some level of inflammation in your body to stay healthy. However, when that inflammation, not inflammation from an acute bacteria or virus, but when we have chronic inflammation in our bodies, that leads to things like chronic inflammation in the tubes in our lungs, leads to asthma. Chronic inflammation in our kidneys leads to high blood pressure or kidney failure. Chronic inflammation in your intestines can lead to colitis or cramps and diarrhea. Chronic inflammation in your heart can lead to congestive heart failure or myocarditis, right? So those are ways that inflammation is bad, okay? And so again, the difference between chronic inflammation and acute inflammation, remember, acute, A, it's like an A on a paper, is good. Chronic, C, not so good. So acute inflammation, I just came up with that on the fly. Acute inflammation is redness, warmth, pain, swelling, loss of movement and function. Okay, that is necessary to help and heal your body. It's a series of biochemical reactions, not to geek out on you and get all science nerd. When that inflammation becomes chronic, there's a lot of times no symptoms or no severe symptoms that you relate to inflammation, or that you connect with inflammation, because chronic inflammation is low grade. It's systemic, which means it's all over, and it often just slightly damages your tissues, and so it happens over time is when it becomes severe. So it can go on for years and years and years, and you don't notice it until you have heart disease, cancer, an autoimmune disease, multiple sclerosis, Crohn's, rheumatoid arthritis. Those kind of things are the result of long-term chronic inflammation. Now, I'm pointing at you with my Copa, because I'm playing with it in my hand. But how do you increase your risk of chronic inflammation? Well, you eat a sad American diet. You're obese or overweight. And don't even look at pounds or that dreaded BMI for that. Look at waist circumference. If you're a woman and your waist is over about 35 inches, then it's time to look at reducing that. If you're a man, that number is 40 inches. An existing heart condition, a family history of heart disease, all of these are increase your risk factors for chronic inflammation. Poorly controlled diabetes, a sedentary lifestyle, so you're not moving around, and you don't have to go out there and do killer cardio. You just got to move. If you're a smoker, if you have a chemical dependency, if you've had long-term infections, gum disease, not taking care of your teeth, or if you have high stress, right? So there's a few different ways that you can determine if you have chronic inflammation. Unless you're Dr. McCullough, you probably have some level of chronic inflammation. Even if you're working to reduce it, it may not be gone completely yet. So you can do a couple different things. You can do a C-reactive protein. You can ask your doctor to do that for you. Or if you need a way to get that without going to see your doctor, let me know. I have labs that will do that for you. Or an ESR, which is a SED rate. Those can be specific lab indicators of chronic inflammation. And you can also use a fasting blood insulin level for this purpose. A lot of times it's used to screen for diabetes, but it can also be an inflammation marker because the higher your levels of inflammation, the higher your fasting blood insulin will be. So how can you treat inflammation at its source naturally? So the biggest thing that you can do, and the thing that'll help you the most, is focusing on eating a healthy diet. You really are what you eat. Okay, so that's not this low-fat crap. It's avoiding inflammatory foods. So avoid trans fats, avoid foods fried in trans fats, avoid sugars, avoid all grains, avoid foods cooked at super high temperatures. So like overcooked scrambled eggs, that oxidizes the cholesterol and turns it from good cholesterol to bad cholesterol. So if you can't cook at all and you can't cook scrambled eggs, you should definitely learn to cook them gingerly. You want to get plenty of animal-based omega-3s, not plant-based, animal-based omega-3s. You can take quality krill oil. There's a lot of different options, but you want to make sure you're getting animal-based omega-3s. Move regularly. Again, you don't have to do killer cardio. Walk 30 minutes a day. A slow walk is fine. Some yoga is fine. Just you have to move your body. It lowers inflammation and it doesn't have any of the side effects of taking over-the-counter prescription medications. Obviously, stop smoking and stop any chemical dependency, right? Like that's a go-to. If you need help with that, I help people quit their vices all the time, so let me know. I talked a little bit about waist size. Again, women, that number is about 35. You want to start looking at shrinking that if you're above 35. Men, that number is 40. And then one of the biggest things is having a healthy outlet for stress and negative emotions, okay? Meditate, work out. All of those things help you have a healthy outlet for stress. You can use essential oils for that. And then vitamin D levels. Even if you're taking a vitamin D supplement, because remember, the best way to get vitamin D is outside in the sunlight. And I fell prey to this too. Vitamin D, when your levels get low, your immune system gets low. And I had a terrible cold last week because I didn't switch to my oral vitamin D now that it's getting fall and I'm not in the sunlight as much. And so it allowed my immune system to come down, allowed that sneaky little virus going around the kids' school to sneak right in. So if you're looking at supplements to help, okay, number one, you've got to eat healthy. Number two, you got to move. Number three, supplements that help. Again, omega-3s, vitamin D, and get your vitamin D levels checked. You may be surprised that either the vitamin D you're taking is not bioavailable, so it's not being absorbed. So it's really important to have those vitamin D levels checked. And I can talk more about that at another time. If you're if you need some additional help, like if it's not moving fast enough, you can use Copaiba, and that might be backwards for you, I'm not sure. Copaiba is part of the Young Living Vitality line, so that means you can take it internally. You don't want to take essential oils internally long term. If you need help with the dose, hit me up. Other things you can take, resveratrol, turmeric, boswellia, bromelain, ginger, evening primrose oil. And that's a lot of choices. So check out my muscle testing video to find out how to determine which choice is right for you and which choice is right for your body, because your body knows. Okay, so if you have any questions, post them below, whether you're watching this on my YouTube channel or on my Facebook page or on my website or in my newsletter, wherever you're watching it, and stay in touch. Namaste.